Hello and welcome dear learners to the NPTEL course on Healthcare Quality Management, Infection Control and Patient Safety. In the Module 5 Operational Excellence in Healthcare, in the Chapter 56 Importance of Communication in Healthcare Quality, we will be dealing it. With respect to the previous chapter's discussion, which was more for the medico legal part, and how we have seen that the medico legal aspects were covered to be seen for the importance of communication which can resolve the medical negligence issues. Now in this particular chapter, chapter 56, we will be discussing about the stages of communication competence and how in communication is being seen in hospital settings and the barriers to effective communication. So, as we have to be seen that how healthcare communication plays an important role, how information is exchanged in healthcare services to improve the desired health outcomes. In the current era and the cutting edge technology, lot of fundamental components sometimes get neglected. And we find that there is a great importance of effective communication to be seen over here. The effective communication plays a very important role in providing the quality healthcare. It is also very important in ensuring patient-centered care, which is a very important aspect of patient safety. What are the communication supports that can be seen over here as? It can be with a physician-patient relationship or a healthcare professional support staff. So it is very important that the patient's family, patient's relative, or those who are in the support staff also can be seen as a very important communication supports. A very primary and very important person whom you can see as to be target for communication support is the nurse, and which can develop actually the healthcare providers and the health receivers relationship. The healthcare system and the patient needs to have a sort of a communication support system. The effective communication is necessary to provide accurate information. Accurate information which is very important with respect to reducing actually the patient safety concerns and improving the healthcare quality. Also, support patient autonomy, which is a right of the patient to understand and to know what are the healthcare services which are rendered to him or her. Also, ensure shared decision making, which is very effective to be seen as to improve the health outcomes. But if there is a lack of communication skills, what will happen? Which is very important for a healthcare professional to understand that it can undermine the trust of the patient. And thereby we find a lot of litigations which we have discussed in the previous chapter are more only because of the trust factor. All the ethics which raise a concern to a patient or sometimes being seen as a medical negligence are only and only because of the trust which is to be gained by the medical professional towards the patient. Adversely affect the patient interest when the patient needs to understand or the patient has a right, and when it is denied, it has been seen as a lack of communication and it is being identified as a skill actually which is lacking in the healthcare professionals. Now we will see a case of Mr. Kumar. Mr. Kumar went to an OPD, and Mr. Kumar's outpatient journey, OPD journey, is being depicted over here. So, a healthy Mr. Kumar at his 60th birthday went to a hospital. He visited to a hospital in reluctant. He went to the registration desk, and you can understand he requested a health checkup, which is very important for a person. He was to be identified as a very healthy person and he has no complaints. On the other side, you may find the receptionist says, "Why? Why?" which irritates Mr. Kumar for a moment actually, which we find that was the first impression that Mr. Kumar faced over here. Because there were a lot of complex steps actually which was involved actually which made Mr. Kumar irritated. There were multiple steps at registration, taking the admission, actually to understand what are the OPD procedures, actually to take a token and to have a lot of communication, which created a lot of issues in this case. The first is there is a confusion which is being seen to this particular patient. Mr. Kumar find that there is a lot of delay with respect to the OPD consultation over here, and even poor first impression was created, which is very important to be seen, which goes against the healthcare institution. And it was more because of the first, as a receptionist, Second, as a reception desk and the people who are involved with respect to giving the consultation, or I mean to say an appointment. What does it really reflect to? It reflects to inefficient system and has been identified that particular hospital or the staff in that particular hospital is not possibly taking the concerns of the patient, and it is a lack of guidance that the patient has seen. So what does it really creates? This is a case of poor healthcare communication, and it has been identified that lot of Indian hospitals do such go with an impression towards the patient where there is lack of communication actually, which makes the impression which similarly Mr. Kumar has in this case. Now we will see the stages of communication competence. We need to understand the Noel Birch model actually, which shows that what are the stages of communication competence and why an healthcare professionals need to get the communication components. So communication competence is very important with respect to the increase in need of healthcare communication nowadays, and which has played a very important role actually to reduce the medico-legal litigations and even to understand the patient more fair and to give patient-centered care. What is the first line we can understand is the unconscious incompetence, that is unaware of mistakes, no intention to improve. And this is a very common situation that most of the patients come across. Then comes the model's second stage, that is conscious incompetence, because they are competent but they are conscious actually for that part, which realizes the mistake still lacks in skill. Skills are not improved over here, but they understand that they have done something as wrong. In the previous case, it was that no intention to improve, means like there was a lack actually on the part of attitude and ignorance, where versus mistakes were being seen as unaware. Here in the second case was that it was a realization of mistake, but the skills were not improved, which is very important actually to make it more clear to give towards the services. And on the third picture, which is being shown in yellow, is like conscious competence. Consciously practicing skills actually and improving actually to give a fair reasons actually, which is a fair reasons actually to improve the communication. And the last is like unconscious competence. So you may see the skills become automatic, communication become effortless, and it is very important that you may need to work on this part from going from stage 1 to stage 2 to stage 3 and stage 4. And this can be seen at the different stages that the patient may come across actually to the situation where they are being identified that how the communication with respect to the healthcare providers was. So if you take the help of this particular model, you can understand that you can improve the communication competence of your professionals or your staff. Now, communications in hospital settings. And this is very evident to be seen that the communication in the hospital setting comes with the component, and which can be seen in this particular figure, that it is being broke down actually, and it has been seen through different ways. So if you to come across the communication types and channel, I mean to say interactions which is more from the patient's provider and between providers also. It can be providers and administrators and between administrators. So there are different interaction which goes and which contributes actually to the patient experience. It also contributes towards the hospital image, and this can occur face to face, it can occur from telephone, it can be occurring from written. So there may be a patient who is communicating to the provider, that is healthcare provider, a, a provider to provider also can be from a nurse to doctor and all that. Between the administrators also there can be a communication, and even from providers to the administrator it can also be. So you may find that a lot of interaction goes and lot of channels are explored actually, which is one an important thing that you can find that most of the thing it contributes actually to the patient experiences that the patient find that they are poor into scene. What are the verbal communication styles? It can be aggressive, where it can seen that sometimes the communication is very loud, it is interrupted and even in dominated. Sometimes there is a passive communication which we can be seen with respect to verbal communication, that it avoids expression or doesn't speak or even accepts infringement. There is sometimes an aggressive communication, but it is a combination of passive aggression, that is indirectly hostility, not giving particularly or avoiding. It can be seen lot of cases in the COVID time that there was a passive aggression which was being seen in a lot of communications towards the patient. Even sarcasm, identifying sometimes the patient gender, the patient caste, race, or even age-wise, actually there was seen as a lot of sarcasms which were being put as in communication actually towards the patient, which was being identified or even can be seen as a very subjective observation of the patients. And assertive communication, that is a clear, respectful, confident and best for the healthcare, which is very important to clear that what the communicator has to put, the healthcare provider has to put, and even towards the patient with respect to all the age, gender, and even with respect to the patient paying status, respectful, confident communication is very, very important. To breach and to understand the lack actually where it is very, very important over here. With respect to the first impression which we have seen for Mr. X actually, where you can find the influence by registration staff is very important for a patient actually. The influence of the security personnel, the influence of the environment in the hospital, the influence of the entire environment, which can be hygiene, which can be services, or even the tariff, and even the signages. The first impression is very crucial actually, and no second chance to be given to the patient, actually a patient's relative, to affect the trust, to affect the compliance, or even the overall satisfaction, which can be met directly in proportion to all these things, which can be seen as when you try to improve the communication. The very first and very important part is that it is the registration staff. The compliance actually towards their duty and the work is very important. Security personnel, environment, and environment with respect to even a quality also. Now, when you come across the physician-patient encounterment, with respect to Mr. Kumar's case, that what we have discussed, the initial counter delays actually, which was more because the physician uses jargon, no explanation, and Mr. Kumar was anxious and unheard. Subsequent encounters with respect to cardiologists, technicians, nurses, communications was gapped actually, being identified that a lot of interruptions were coming. Lot of rushed explanations were there. There was no time, no touch, and no emotional connect. And this has resulted in confusion, emotional distress, and disused trust to the patient, and which has resulted that the patient was unsatisfied. What are the non-verbal communication versus to the verbal communication? Non-verbal communications are facial expressions, eye contact, gestures, body posture, tone and volumes, touch, personal appearance, and silence at to an extreme level, or silence actually which is sometimes which is giving a very different way of expression. So non-verbal communication also plays very important role actually, which can be seen as enhancing the hospital settings actually, to give us an impression what really the hospital is really trying to communicate. I mean to say the healthcare professionals over there. So what is the importance of active listening in healthcare, and why we need to emphasize as an hospital administrator, healthcare quality personals, or even healthcare professionals actually, who need to understand the importance of active listening. The listening versus to speaking, where it is very important that you need to be a patient listener. A good healthcare professional is a one who is very actively listening. Actively listening means like with respect to attention, with respect to empathy and clarification and feedback, which is very important that when you have to build a trust, to improve the compliance and to enhance the patient satisfaction, it is very important that you need to have an active listening. Active listening speaks with respect to the attention listening. You need to have empathy towards the patient rather not sympathy. You need to have a clarification with respect to the concerns, queries, and even the trust part actually. And also you need to have a more conscious mind towards active listening for the feedback which the patient or patient's relatives are giving. With respect to average interruption, ideally you need to understand that 80 into 23 seconds actually you need to pass, and you need to have an uninterrupted break of understanding that the communication of the patient need not to be halted. So what are the types of listeners actually? You may see that with respect to understanding the psychology of the patient, you need to understand the mind reader actually, who can understand the patient needs or patient's relative needs. That can be a rehearser, that can be a comparer, a filter, a fixer, dreamer, and delayer. These are the different types where you can understand how a conscious and a patient's listening is very important for a healthcare provider to improve the health outcome of the patients. Managing the patient's expectations in healthcare. Nowadays, we can understand with respect to the whole high-end technology, the need of patients' concern has increased. With respect to whole lot of inevitable situations and unprecedented situations which are increasing, the patient expectations are increasing. With respect to education and the advent of internet and lot of surfing with the patients are prior coming and giving you a lot of challenges, the patient's expectations are increasing. So what does it really results to? It results to a lot of failures. It results to anxiety, it results to dissatisfaction, it results even to the wait times and even the diagnostic delays. This may create a problem to a patient, and the patient may be more one who is very disappointed. Or sometimes you may find lot of complaints which are more only and only because of the increased patient's expectation. The patient's expectation may be with the image of the hospital, maybe with the previous experiences, maybe with the respect to the cost. So, lot of a time with respect to quality, it has been seen that the communication can bridge the gap of mitigating the expectations of the patient. What does the hospital should do? The hospital should streamline the process. They need to work on training of the staff with respect to the R&D part, who need to understand through the root cause analysis that what are the gaps that they need to fulfill with respect to increasing the communication and mitigating the patient's expectation. Improving the transparency part need to give a clarification with where the patient or patient's relative has some doubts, where sometimes they need to have some clarification with respect to the tariff, with respect to the services that are offered, or with respect to a physicians, or with respect to the services of room or even specializations that they need to go. If you are not able to communicate it properly, it becomes an issue of expectations which are not fulfilled, and it leads to major dissatisfaction. Major dissatisfaction can come also with respect to clear communication. If you have a clear communication, it helps to align the expectation of the patient, which is although otherwise being said that it is not possible, that even though if you have a clear communication, the patient's expectation may not be met. But it is duty of a healthcare professional to meet the requirements of the patient, and the services need to be more focused towards the patient-centric approach. What are the barriers to effective communication? Although when we have discussed everything with respect to communication, what is there that there can be a barrier to effective communication? From a healthcare provider side, it is very important that whenever you have a language deficiency, it has been seen as a very important barrier with respect to the healthcare provider. Language deficiencies are not to be seen as an alternative actually, because there is a very important reason that when a patient has to communicate it in his own language, it can breach actually the gap. There is again one more thing in addition to this is like personal preoccupations. Actually, when it is being identified that a healthcare provider has some personal preoccupation, it leads a major problem with respect to communication, with respect to the clothes or the person's presentation or even the gender, or with respect to his age. There can be some personal preoccupations. Actually, it can be found as a prejudices that the healthcare providers are carrying. Even excessive use of jargons, which is very difficult for sometimes for the patient doctor's communication, nurse patient communication. And excessive jargons really makes difficult for the patient to understand the issue, and it raises a concern actually for that the patient is not getting a proper communication. So you should try actually to minimize the jargons or even to communicate in a simple language. Again, very important thing over here is that unempathetic delivery of the services. While communication plays a very important role, when you are empathetically delivering the services, it becomes very important to connect the patient trust, to give a faith to the patient for the services which are being seen. And sometimes there are even seen as a biases towards some of the healthcare providers' behavior, which are more towards certain group of people, certain age group of people, or certain gender of people. Sometimes it has been seen that access to healthcare is more connected with the healthcare providers' communication. Lot of the time it has been seen that lot of communication aspects come more with the frequent interruptions. The interruptions which are being seen that, as or we have stated in the previous slide, that 18 to 23 minutes or 18 to 23 seconds or 25 seconds the patient or patient's relatives who are giving their complaints or even they are discussing with the healthcare provider, they need not to be stopped. What are the barriers to effective communication with relation to the patients? Illiteracy or no knowledge, or sometimes it has been seen that unawareness is also being seen as a very important barrier or a hurdle towards the patients. Superstitions with respect to certain type of health conditions or treatment medical conditions are one which has been seen as a major barrier. Cultural beliefs which comes very strict or which can be seen as absolute actually to take it that the patients really are difficult to make it explain, or preconceived notions, prejudices which are carried from generation to generations or with respect to region or with respect to some of the races, which makes it very difficult for the healthcare provider to communicate it properly to the patient or patient's relative with respect to his condition or medical conditions and the treatment to be given. What are some barriers actually to effective communication with respect to environment? It can be the circumstances with respect to environment which can create a barrier actually in the healthcare provider and the healthcare receiver's communication, that is long waiting periods, which are to be seen as a major point of dissatisfaction among the patients and patient relative. Lengthy admission stay or discharge process, long stay of a patient in the hospital which can reflect to many conditions, even out of pocket expenditure, even can see as giving a chances for the patient to get more HAIs, or even the discharge process if they are difficult or having taking too much time, it is more like it is affecting to the hospital as well as the patient also. Poor signages has been seen as a major problem of lack of services, or sometimes it is more like a communication which the hospital is not putting to the culture actually to see that they are trying to make effective communication. Poor signages also lead to a lot of hassles actually and lack of services actually to be delivered, and it also affects the quality of services. Additional to this, lack of clear delegation. Lack of delegation is an administrative part, and it can be seen on daily basis that most of the hospitals who are having this environmental related issue is more because of non-clear delegation, which is being seen as a very important part of administration and governance. Also, very important thing here I want like to add, it is more related to the patient relation officer or public relation officer, which is or even for the discharge team, where it is very important role from the nurses to the administrator with respect to the breaking bad news. Lot of time it has been seen that most of the hospital employees or hospitals are facing vandalization. It is more because the important part of breaking the bad news comes in very important picture. What is the overview of this? That necessary but challenging that you need to work on the sensitivity part when you are breaking the bad news with respect to the experience preparation, that it is not being seen or not done properly. The poor delivery can traumatize the system and can see that it can be even leading to problem to the healthcare professionals. What are the preparations that need to be done with respect to bad news? It is like the self emotional readiness and to communicate it to the patient to make it aware with respect to the environment. It can be even a private communication which can be delivered, or a calm and composed with respect to empathy part which can give more solace to the patient's need and even the patient's access to understand or the patient's relative. That is called a preparatory phase for this. The second phase comes with the performance part, where you need to be very clear, very honest in your information, and even direct but compassionate delivery is one which gives you more benefits of the performance part over here compared to the preparation part, which is very in align actually that the first step and the second steps go hand in hand. Then comes the palliation part, which is very important when you are breaking a bad news, the emotional support, particularly by the nurses, administrators, and the discharge team. The empathy and the validation plays a very important role here, where you find the communication is more towards the empathetic delivery of the healthcare services. It is very important that your words may play more role than your actions, which is very important. The validation and the emotional support towards the patient is one which can help you to communicate to the patient's relative. And no doubt, the very important and the very strong pillar for the entire process of breaking the bad news is more lying on the planning part. The planning part is very important, which gives you the future care plan where you need to learn from your experiences. You need to learn from the ill communications or lack of or deficiencies that has been seen or reflected from the patient's feedback, from the patient's experiences, or even the subjective remarks which are being given. So follow-up arrangement need to be done, or sometimes if there is a need, a root cause analysis can be done with respect to the breaking of the bad news. So with this we come in and to the discussion of this chapter, where I want to like to summarize and state that effective communication is a fundamental to quality healthcare, influencing patient safety, clinical outcomes, trust and patient-centered decision making, which has been a very fundamental way of dealing only and only through effective communication. Patient experiences begin in the first point of contact, where poor system, unclear process, and inadequate guidance created confusion and dissatisfaction, and it has been seen the case what we have discussed of Mr. Kumar, and how Mr. Kumar has seen the failure in the system. The communication failures also during the patient-provider encounter, such as use of medical jargons, poor listening, lack of empathy, lead to anxiety to the patient, misunderstanding and reduce the trust, which is a very important part that the patient-providers encounters need to be tackled very sensitively. Organizational and system factors, including inefficient workflows, delays, weak coordination among the healthcare staff, further compromise the effective communication, where it can be seen that it is more a part of administration and governance to improve this. These challenges culminate in multiple barriers to effective communication, and it can fuel actually to see the reputation of the hospital or the healthcare organization gets faded at the provider, patient and environmental level, directly impacting the quality of care. So with this, we come an end to the discussion of this chapter, and you can take help of these references. So I bid a bye to you for this. Thank you very much.